So there's so many questions about testosterone therapy out there, and you know, when are my testosterone levels too low? What should my testosterone levels be? Does testosterone cause this, and that? So when I'm going to go over some of these frequently asked questions about low testosterone, probably one of the first things we always get is, can low testosterone cause ED? The answer is yes. Low testosterone can cause ED. Now let's go ahead and reverse that question a little bit. If I have low testosterone, will I have ED? The answer is no. Just because you have low testosterone does not mean that you're going to have ED. So how do we address this? Well, if ED is a concern, we definitely need to be looking at your hormones, and we need to be looking at testosterone. We also should be looking at other hormones in the body, such as sex hormone binding globulin, your testosterone free value, DHEA, estrogen, blood sugars, vitamin D, etc. Because many things can affect ED. But the answer is yes. If I have low testosterone, can it cause me to have ED? The answer is yes, it can. So whenever we're prescribing testosterone, right, in terms of like the indications of testosterone, there's not a direct indication for erectile dysfunction, right? So in terms of like the technicalities of the information that we have about the drug, testosterone replacement therapy, there's not going to be a direct indication. Oh, I have ED, he needs to take testosterone. This is where your doctor comes in. This is where the art of medicine. We are practicing medicine, guys. It is an art. It is about taking all these different values, putting them together, and find out where you're at. If you are experiencing ED, come on into practice and let's test all these values, including your testosterone. And then what you're supposed to do is listen to the other thing the patient has going on. His lifestyle, his family history, any kind of possible drugs or anything he's taking. How does he respond to Viagra, Cialis, or the generic forms of sildenafil and tadalafil? Is he responding to those? How's his love life? How's his sex life? Is there any abuse in his life, in particular sexual abuse? Those things can also be affecting our sexual performance. So there's a lot to the ED picture. If you have ED picture, you definitely want to see a specialist such as us here at the Phoenix Men's Health Center, right? Because we'll be able to get down to the root of the problem, and we're guaranteed to help you with your condition. So that's one of the most common questions we get about, if I have low testosterone, will it cause ED? Another question we get is, can low testosterone cause anxiety? Well, I don't know if low testosterone directly can cause anxiety, right? I do not know of any research that is directly tied into that. But let's talk about the clinical perspective. Having been a physician working in the world of testosterone therapy for 12 plus years, this is what I do. This is what we specialize in. What I have noticed is that if we have guys that come with anxiety and depression, and they have low testosterone, and then we start to work with them, usually what we're going to do, we're going to do a full blood work panel on them, testosterone, thyroid, DHEA, estrogen, vitamin D, and a few others. We're always going to find a few things that are off balance. Usually we're going to see a very low vitamin D level, and we're going to see a low testosterone level. There might be a few others in there as well. So we'll start to go ahead and we'll replace that. We'll start fixing this with these guys. We'll start giving them bioidentical hormones. We'll start giving them bioidentical testosterone. Start getting vitamin D, other things. And then what we notice is that the anxiety does decrease and their depression gets better. They're happier. They feel better. They sleep better. They feel stronger. And there is a change in their mood. So I cannot tell you directly that low testosterone causes anxiety, but I do know that if you have anxiety and depression, this should be an avenue that you're looking into, especially if you're an older man. Now, even if you're a younger man, I see no harm, no foul in testing your values to see where you're at. Now, keep in mind, this is where you need to see a medical professional. Nothing is going to be cut and dry. Nothing's going to be this equals that. In the world of medicine, you are a holistic being. All these pieces work synergistically together. So whenever we're going to treat you, that's exactly how I have to look at you. That's why you need to do an extensive blood panel. So don't be fooled in thinking just one thing is going to equal another. It's going to be comprehensive. So if you guys feel that you might be suffering from anxiety, you might be suffering from depression, poor sleep, and overall just not feeling good, having low vitality, a low mood, a low libido, this is something you guys definitely get checked out. So what kind of signs and symptoms does low testosterone cause in your body? What can testosterone do for me? Do I need testosterone? There's many questions that are associated with testosterone, not just in how it works in the body, but if I am going to take it, How do I take it? Should I take it? Do I need to take it? There's so many questions out there. And you guys know as well as I do, on the internet, it is just flooded with misinformation. So, most common questions we have about testosterone is, can testosterone cause brain fog? And the answer is yes. Let me rephrase that, I'm sorry. Can low testosterone cause brain fog? And the answer is yes. So if a guy does have low testosterone values, it can affect his mental clarity, you can think his sharpness and his acuity. It can make a difference. So if you are experiencing brain fog and fatigue in particular, with those two together, and then erectile dysfunction on top of that, you really need to go and get your testosterone levels tested. So whenever you guys are going to go to get your testosterone levels tested, I want you to be sure to check your testosterone total, your testosterone free, your sex hormone binding globulin for sure, and a few of the labs you should consider including too, such as estradiol, estrogen, DHEA, thyroid, cortisol, your red blood cells, your white blood cells. But we're here to help you guys with that if you ever have that, just coming into practice. So, can the low testosterone cause brain fog? The answer is yes, it can. So if you start to administer testosterone, will it help to alleviate that brain fog? It could, if there is a direct connection to that, right? If you start taking testosterone and you're realizing, like, wait, my symptoms are not going away, and it's been some time, 4, 6, 8 weeks, and the symptoms are not going away, this is when you have to definitely touch base with your doctor and figure out what else is going on, because there's always something else that could be going on. So remember, as we're going through these questions, there's always something else that could be going on. Testosterone therapy is fantastic, right? But it's not always the magic bullet. So if you're taking this medication and things aren't getting better in the areas of your concern, we need to go back and revisit. Let's do some full blood work on you, and let's see what kind of a comprehensive plan we can put together for you.